All right. Thank you, Meg and Diane, for popping that into the chat. Again, if everyone else wants to introduce themselves, let us know what block you're representing. And then King, you can go ahead and get started.
Well, first and foremost, we just like to thank everyone for attending and participating in our respiratory webinar. All right. So this session will be recorded and uploaded to YouTube. So anyone who couldn't attend today's session can still get the information. It will be sent to you guys in a follow-up email. So the recording, in addition to the presentation, will both be sent to you at a later date. So you can share with other individuals who weren't able to attend or who may be interested in the information. So questions and answers. So if you have any questions throughout today's session, please type them in the question and answer box. We'll answer all questions at the end, or we'll type the questions back to you during the presentation. If you are calling in and your questions are not answered, you can call us at 215-685-5488, or you can always email us at publichealthpreparedness@phila.gov. Again, thanks to everyone for the health department here to help answer some questions. Okay, so today's training is specifically geared towards block captains. Philly is a city of neighbors, and block captains are so important because they keep Philadelphians healthy and safe, right? So with today's presentation, we are hoping that this training will help educate and inform you on how to stay safe this fall. Then we hope that when you return to your communities, you can share some of these techniques to plan, prepare, and respond to respiratory health this season. So first and foremost, we like to just thank our block captains for being outside and providing information. You guys do so much for your communities, and we just wanted to highlight some amazing things that you do for certain residents. So it can be things just like being that neighborhood leaders, so providing that information, providing insight, providing counsel to individuals who may need it within your communities, serving as liaisons between the community and necessary resources, building a vision for clean and beautiful for a beautiful block. So just making sure that trash is being picked up if it's not, if individuals have no soliciting on their homes and residents, you guys are just making sure that people aren't leaving things like that around, and knowing and building relationships with your neighbors. And that can be as simple as just saying good morning or good afternoon to individuals, or having more profound conversations with individuals also. And the list goes on in all that each of you do, and we can spend so much more time on it. But the health department just wants to thank you guys for your work that you do within the city. Okay, so today's presentation will be discussing respiratory viruses most common in the Philadelphia area this season. Since you all are pretty busy individuals and it is pretty late, we're going to try to get through this presentation, within a decent amount of time. But first section, we'll discuss the respiratory virus most common in Philadelphia, like I previously said. Then we'll discuss the big three viruses. So things like what they are, how do they spread, and how you can keep your community safe. And then lastly, we'll discuss the updated vaccines and where you can get them for free. We hope that this presentation has helpful and useful information. So please let us know if you have any suggestions for how we can improve our presentation or this webinar for future attendees. Okay, so before we actually start today's presentation, one thing that we're going to be doing a little bit differently today that we're trying to test out is having a poll towards the end of today's presentation. The poll, basically, we're basically trying to figure out, well, we're basically trying to start saving and creating 1 minute 1 minute clip videos or short videos to then be posted to our social media pages. So more individuals can interact with our videos. So if you guys could, if you could pay attention, well, pay attention during the presentations to the sections that you felt like were most important, were most engageful, had the most insight, and were most beneficial to community members. Because towards the end, we'll ask you guys to vote on the top three sections that you felt were most important.
Mm.
And now I'll be turning it over to Jasmine, where she'll talk to you about the big three respiratory viruses this season.
Good evening again, everyone. Thank you all for letting us know where you're from in the chat. We love to see you guys turn out because we love the support that you have. I'll be talking about the big three viruses and what you can expect and how to stay safe. So first up, obviously, the big three viruses that we will discuss are influenza, COVID-19, respiratory syncytial virus, also known as RSV. We will go over ways that these viruses are similar and different in the coming slides, as well as what you can do to protect yourself and your community. It's important, as we have written here, getting vaccines, helping prevent the spread, and assessing testing and treatment when necessary. I'll just go through each of these. The seasonal flu or influenza, as we all know, is a common respiratory infection that affects the nose, throat, and sometimes the lungs. Flu season runs from October through April. It also is important for this fact that vaccines are updated every year to protect against the most common strains. So every year, the flu vaccine is updated, which is why we ask that people get vaccinated for the flu every year. It is recommended to get vaccinated in September or October, early in the season, but it is still helpful later in the season if you have not gotten it yet. We're about to go into November, so do not fret. Don't worry. Let your neighbors know that they can and should still get their flu vaccination if they have not yet. Just because you haven't gotten it in September, October doesn't mean that you shouldn't get it. Whenever you get it, it will protect you throughout the flu season. So it's important. Everyone 6 months and older is eligible for the flu vaccine each year. The vaccine cannot give you the flu, but obviously, we probably all know that once we get that vaccine in the year, we might have some side effects like mild um, arm soreness where you got the shot, headache, fatigue, things like that. All these side effects are normal and typically go away on their own. Obviously, if you have a more severe reaction or a reaction that you've never had before, seek medical attention and talk to your doctor about flu vaccination. You want to get vaccinated to protect yourself from severe illness, hospitalization, and even death, unfortunately. So we like to make sure that everyone knows that these vaccinations don't prevent you from ever getting the illness, but they prevent people from having a severe case of the illness if they were to catch the flu. You can get your flu vaccines at your doctor's office, pharmacies, and even our city health centers, which we'll go over a little later. King will go over that for us later. Next up, we have COVID. COVID is caused by the SARS-CoV-2 virus. That's a mouthful, but it usually affects the upper respiratory system and can lead to serious illness in some people. Since 2019, the virus has mutated or changed, and this causes different variants or types. And this is why the COVID vaccine is being updated every year, just like the flu vaccine, to help protect against those new strains of the virus. Everyone 6 months and older is also eligible for the COVID vaccine and should get that. Staying up to date is especially important for people at higher risk of severe illness from COVID. These include people that are 65 years of age and older, people with conditions that put them at risk for severe COVID disease, young children ages 6 to 23 months old who have not yet been vaccinated, and persons who are pregnant, postpartum, or lactating. So we want to make sure we're protecting those high risk groups so that we can keep everyone safe and decrease hospitalizations and even death. RSV, also known as respiratory syncytial virus, another mouthful, is another common respiratory virus that causes usually mild cold-like symptoms. However, it can be dangerous for certain groups, especially infants and older adults. In older adults, RSV can sometimes lead to more serious problems like pneumonia, worsening asthma or chronic obstructive pulmonary disease, also known as COPD. Heart issues such as congestive heart failure as well can be a complication of RSV. The good news is there is a vaccine that helps prevent severe RSV illness. People that should be getting this vaccine and are eligible to get this vaccine are older, all adults 75 years of age and older, as well as older adults that are 50 years of age and older who are at increased risk of RSV, severe RSV disease, should get this single dose vaccine. Pregnant people should also get the vaccine to prevent the illness in their infants. And infants less than 8 months old whose birthing parent did not get the RSV vaccine, probably because um, some eligibility criteria, these infants should get their RSV antibody in their first RSV season. So that's a lot to memorize, but we just want to make sure that pregnant people in order to protect their infants and infants who qualify for the vaccine, and then older adults should be getting the RSV vaccine. And you can get all three of these vaccines that I've just talked about at the same time, knock it out of the way. It might be a lot, but if you get them all at the same time, you don't have to go back. And RSV is a little bit different from COVID and flu. You don't have to get it every year. Just get it once and you're protected. So if you already had it or you know people who have, then they've already been protected. But if someone hasn't gotten it yet, they should get it. So it's important to note that these viruses have many symptoms in common, and they present also kind of like the common cold as well. So it can be really hard to tell which virus you have. These common symptoms include fever, chills, fatigue, cough, headache, and honestly, the list kind of goes on. The only way to tell the difference between these viruses is by testing. Getting that COVID test, getting that flu test, like we'll talk about a little bit later, will help you be able to tell what virus you might be suffering from, and that can help tailor treatment plans. So again, testing is needed to tell the difference, and you can get combination tests at resource hubs, and King will talk about that a little bit later as well. One thing that I do want to point out, unfortunately, the landscape of public health information right now is rapidly changing, constantly changing, and we just want to make sure that you, as block captains and trusted messengers in the community, can have uh, access to important trusted information that you can give out to your neighbors, those blocks that you help keep safe, your loved ones, and know where to get that information for yourself. So we recommend first and foremost that everyone have a trusted primary care provider. You can find an affordable primary care provider at our um, primary care finder. The link is there. The link was posted in the chat by Maria. Thank you. This is a finder that you can look up different ways to get a affordable primary care physician. And also King you'll hear this multiple times throughout the throughout the training. So the Community Response Partner Network, we call it our CARPN, is a network where we send out newsletters to the people in our network with the most important and updated public health information. So it's a good way to stay connected directly with us and what's going on in your community. And lastly, the PDPH website is updated, constantly reviewed, making sure that the federal guidance that is appropriate and local recommendations are up to date on this website. So if there's any information that you need and need to look up, then the PDPH website is a good resource for that. I'll turn it over to Maria now to discuss how respiratory viruses spread.
Thank you. So, like Jasmine said, we're going to talk about how these viruses spread in our communities. So, we'll start things off with a quick little survey question. Our question is going to pop up on your screen, is going to be a poll. So, if you all can answer that, let me just launch it now. Okay, so the question is, which strategy will not prevent the spread of respiratory viruses? Your options are hand washing, immunizations, cooking food to the recommended temperature, or staying home if you are sick. Again, which will not prevent the spread of respiratory viruses? You can select one, and then we'll give you all about a minute or so to answer, and then we'll check the results. And I'm seeing a few answers coming in. So the keyword here, I wish we could bold it, but the keyword is will not prevent the spread of respiratory viruses. Okay, we'll give it another like 10 seconds or so. All right, looks like we have almost half of folks answered. And we a little bit over half. That's excellent. Thank you all. So the correct answer is cooking food to the recommended temperature. So that is great to prevent foodborne illness, but it will not help you prevent respiratory viruses. So very important to remember the key things here are hand washing, immunizations, and staying home if you are sick. So the three viruses that we're talking about today, again, it's flu, COVID-19, and RSV. All three of these viruses are spread in similar ways. So primarily through the air, when a person that is sick coughs, sneezes, talks, and another person inhales those particles, or those particles come in direct contact with another person's eyes, nose, or mouth. Another way to spread this virus would be if a contaminated surface or object. So if you touch it and then touch your face, and people can spread the virus before they even know that they're sick because you may not have symptoms. So this is called asymptomatic spread. So you might have one of these viruses and not have any symptoms at all, but you can still pass this along. So this is why it's super important to wear a mask in crowded spaces because you just don't know who's sick and they may not even know that they are sick themselves. So seasonal spread. So in the fall and the winter, more people get sick, and that's because more people are gathering indoors, celebrating holidays. Also, no one wants to be outside when it's this cold. More folks are traveling, so you might have some people from your family that live out of town coming. And also, colder, drier air actually helps viruses spread easier. So these are like key things that kind of make this happen. It's like a perfect storm. So discuss your vaccine eligibility with your healthcare provider to protect yourself and your loved ones through the holidays and the colder months. Something that we've been saying in this training is that think of it as a holiday gift. So you get yourself vaccinated or you get tested. You know, if you go to one of the senior expos, for example, and they're giving out a few free tests, give them out as gifts as well. So it's kind of like a more bang for your buck, right? So you're getting some free items and you can also share them with people on your block, neighbors that can't get out and get one. So it's a great way to prevent it. So we'll go right into preventing the spread now. So again, these three that we're talking about are flu, COVID-19, and RSV. So they also are all prevented in the same way. So we have core strategies that will help protect yourself and others. That's staying up to date on your vaccines, washing your hands often, staying home when you are sick and you do not feel well, talking with your doctor when needed, and keeping fresh air flowing indoors. So you could just crack a window and circulate some air. I know it's very cold out and probably unpleasant to do, but even a few seconds would be helpful to keep fresh air moving in your house. So other things like masking and testing are useful in certain situations. So if there is a lot of illness spreading in your community, it's a great time to wear a mask, take a test. If you were recently exposed or just got better from being sick, or if you or someone around you is at high risk for severe illness. So we will talk more about the folks that are in those groups of people that could possibly have a very bad reactions or symptoms and side effects. So if you're going to be around someone, let's say an elderly neighbor, you're going to go have dinner with them, and you're just getting better from getting sick, it's a good idea to wear a mask. So you could take a test also if you're starting to cough or sneeze, even before visiting someone that's high risk. So people who are at high risk include older adults, babies and young children under 5, people with a weakened immune system. So folks with weakened immune system are people that have heart problems, cancer, diabetes, high blood pressure, HIV, respiratory diseases like asthma, chronic obstructive pulmonary disease, also known as COPD, and lung cancer, and more. We have people with disabilities, people who are pregnant, people with certain health conditions, and people who have not been vaccinated. So anyone in these categories experiencing any sickness should always reach out to their primary care provider. So it's super important because your primary care provider can let you know which options are available to you if you are sick. And also, you want to make sure you're taking care of yourself so you're not spreading the illness to other folks that are high risk. So you'll protect yourself, your community, your loved ones, your household members. Okay, and then we also look at social and environmental factors. So people whose jobs and living environments expose them to respiratory illness, they have to take extra precautions during the colder months. So say, for example, you're a nurse, or let's say you have a home healthcare aid gig that you go to in the evenings, maybe, or if you just do something to help someone and you're constantly in their house. This is the social and environmental factor that puts you more at risk if that person is sick and you're spending a lot of time over there. So people with less access to medical care as well, lack of access to healthy foods, people who live in neighborhoods with poor air quality are also at risk of serious illness. So the list is not all encompassing. And remember, the groups that I previously mentioned, you can also fall into that one of those groups and one of these. So for example, a person can have high blood pressure and also suffer from a lack of access to medical care. So it's like they kind of overlap and it's like a double whammy. So now you have two things that are putting you at risk. So that's why we say that the risk factor groups are not all encompassing because you could fall into a few categories. Okay, so next, let's talk about what to do if you are exposed and you get sick. So if you've been exposed to a respiratory illness, the first thing that you should do is keep an eye on how you're feeling. For the next week or two, watch out for any symptoms and take extra precautions during this time. If you have a planner or a calendar on your fridge, you could take note of when you start experiencing symptoms, if they progress, if they get better, if you have a fever, just keep note of that because this is going to be very important for when you communicate with your healthcare provider. So if you're someone that falls into one of those high risk for severe illness categories, you definitely want to keep note of when things start, if they get better, if you take medicine, because you want to check with your doctor early and make sure you give them all the information. So taking these steps not only protects you, but the people around you. So again, it's not just a benefit for you, but for the greater community at large. So testing. So since flu, COVID-19, and RSV can all look very similar, You will never know which one you have just by symptoms. The only way to know which one you have is to take a test. So at-home combination tests are available at our local resource hubs, and they test for flu A, flu B, and COVID. And it's one test. So you're just going to do that swab one time, and you'll be able to know if you have one of three or two of three, or let's hope not, but three of three. So if you're feeling sick, testing helps you figure out your treatment options, especially if you're at high risk. So if you fall into one of those categories, and let's say you take a test and you're positive, your doctor will probably be able to give you some type of antiviral to help you recover faster, or get, something for your symptoms. So the health department recommends testing for COVID if you have symptoms or if you're going to be around someone who could get very sick. So if you're going to spend time with someone who's elderly, or maybe a pregnant family member, or someone who is receiving chemo for cancer, these are the people you have to really think about being around if you're sick or have any symptoms. And even if you test positive without symptoms, so again, asymptomatic, so you could be positive and not feel sick at all, you can still spread the virus. So you want to contact your healthcare provider and take extra precautions for at least 5 days just to play it safe. And at the bottom line from all this is that you'll never know which virus you have unless you test. So test to know. And these free combo tests are available at resource hubs, and they are free. So please check out the resource hub link and definitely pick some up. Or if you see us out in the community, we typically have them with us, and we are happy to give you some. So here's a picture of the test, which looks very similar to the regular COVID-19 test. But just know that this one, it says right there in the black font below FlowFlex, it says COVID-19 and flu A and flu B home test. So again, these are free at the city resource hubs. Please check out the link, share that information with anyone you know. If you go somewhere on a regular basis, like a senior center or a church, a mosque, anywhere, take this info with you, share it with everyone to pick these up. They are free. And again, they look similar. Sometimes people might think, oh, I have enough. I have a ton of these. These are new. These are the combo ones. So definitely get them while we have them. So the most important takeaway this season, again, is if you are sick with any respiratory symptoms, please stay home and stay away from others. If you're at high risk, either due to age or if you have a health condition and you're sick or you have been exposed, contact your doctor right away. I know a lot of institutions use My Chart where you can send your doctor a message. That's the perfect time to kind of jot down in that message when your symptoms started, if you took any medicine, how you're feeling now, and just maintain that line of communication with your doctor. The earlier, the better. So you can return to your regular activities when you've been sick after you're clearly improving and you've had no fever for 24 hours without taking a fever reducing medicine. So if you take medicine to bring your fever down, that doesn't count. You have to be fever free on your own. So once you're back out in public and back in the community, keep protecting yourself and others for the next 5 days. So wear a mask, try to keep your distance, and again, crack a window, improve the airflow. And I know wearing a mask is very uncomfortable. We're all over it by now. No one wants to do it. But just think about the very vulnerable people that live in your community, people who might be receiving cancer treatments, people who have uncontrolled diabetes, people who are not checking their blood pressure on a regular basis. Just think about those folks. And if you could just put the mask on to help them, that's your gift to them for the year, more than just the holidays. And the more precautions you take, the better for everyone. So most people can treat themselves at home. So if you have a cold or respiratory symptoms, you can just rest, stay hydrated, drink a lot of water, and take medicine as needed. And even people who have mild illness may be prescribed antiviral medications by their doctor. But these work best if they're started early. So this, again, you want to contact your doctor early as soon as symptoms begin. If you've jotted down dates and, fever readings, you could provide that to your doctor. I had symptoms of COVID a few years ago and immediately took a test, saw I was positive, contacted my doctor, and she prescribed me antiviral medication that I started that same day. And by the next morning, I was already feeling better. So that was, quick testing, quick message on my chart, monitoring symptoms, starting a treatment option that was available to me. So, that could have been a trip to the ER, to the doctors. So you're saving yourself money, you're saving yourself some health. So just remember, the earlier the better. It's important to speak with your doctor about the best treatment plan for you, even when you go to get your over-the-counter medications. So I know when I'm sick, I go to CVS and walk down the cold and flu aisle and grab whatever I can get my hands on that might make me feel better. But you have to be careful because not everything is good for you. It depended on underlying medical conditions. So certain cough syrups, for example, are not good for folks who have high blood pressure. You have to get a special one. So these are all things you want to talk to your doctor about, and ask any question that may come to mind. So these are symptoms that would require you to seek medical attention. We hope it never gets to that point, but these are concerning symptoms to be on the lookout for. That's difficulty breathing, persistent pain or pressure in the chest or abdomen, persistent dizziness, confusion, difficulty waking up, seizures, dehydration or not drinking enough, not urinating, severe muscle pain or weakness, fever or cough that improves, and then it comes back and gets worse, worsening of symptoms of chronic medical conditions. So think about your neighbors or yourself that has a chronic medical condition. Let's say, for example, asthma, and you get sick and you notice that your regular asthma cough is stronger, it's more painful, you're producing more phlegm. That's something that's a worsening of your already existing chronic medical condition. Again, contact your doctor right away. And if you have a fever above 104 degrees Fahrenheit or 100.4 in babies younger than 12 weeks, these are all alarms. These should send off red flags in your head to call 911. Okay, and I'm going to close out my section with one question. It's going to pop up on your screen, and that is 95% of all people hospitalized for COVID-19 in the US are not up to date on their vaccines. So we'll give you all about a minute to answer. And again, are not up to date on their vaccine. So the majority of people that end up in the hospital when they test positive for COVID-19, what does their immunization history look like? I'm seeing some answers come through, and this is very encouraging to see. So this is great. We'll give you all about 15 more seconds. Get in some last minute answers in so we can have a nice percentage to look at. All right, looks like we have a little over half have answered, and the answer is, if you all see it all coming up on your screen, so correct. So 95% of all people hospitalized for COVID-19 are not up to date on their vaccines. This is true. So this is why we stress it so much, that it's very important to stay up to date on your vaccines, because you could possibly get COVID, but you probably won't end up in the hospital. And that's probably the best we could hope for at this point with this. So I will turn this back over to Jasmine, and she is going to talk to you about respiratory illness and chronic health conditions.
Hi, everyone. So true, Brenda. I see your comment in the chat. It is very important to know statistics from public health. That's why we shared those resources with you all so that you guys can know where to find trusted public health information. And a lot of those sites include stats. So it's important to just stay up to date. So I will be discussing chronic health conditions and how that relates to respiratory illnesses. especially important for people that have these chronic health conditions on your neighborhood block, your friends, your family, or even yourself. So, people with certain chronic health conditions are at risk of complications from respiratory viruses. These viruses can worsen symptoms of pre existing conditions and, in some cases, can lead to new complications. Um, it's actually, in fact, during recent flu seasons, 9 out of 10 people hospitalized with the flu had at least one underlying condition. That's 90% of people that were hospitalized with the flu also had an underlying condition. So it's important to note that if you have these conditions of concern or any condition really, diabetes, heart disease, kidney disease, liver disease, and especially respiratory diseases, that you can be at severe risk for complications, hospitalizations, and unfortunately, even death if you were to get sick with the flu or RSV or COVID. So, in preparation for that, we want to make sure that people know how to prepare for the respiratory illness season. It comes around every year. Honestly, it's around all year for the most part, right? You know, September through April, early May is a really long time. It's basically all year. So we want to make sure that people are know how to prepare for the season. You want to discuss your risk factors, those underlying conditions with your healthcare provider ahead of the fall and winter season so that you can prepare. You can plan on how to keep your medications and important medical supplies safe. You know, with the winter season comes winter storms. I mean, it's been raining all day here, and it's not even winter yet. So really important to just make some of these plans with your doctor. Knowing where to access testing and treatments is important as well. Getting those vaccinations, like I said, those vaccinations don't prevent you from getting the illness at all. They prevent or help prevent severe illness, that hospitalization, that death from getting sick. You want to make sure that you're preparing for the season by taking your medications as prescribed. If you have a health condition, you don't want to make your chances worse by not taking medications as prescribed so that you can manage your chronic health condition as much as possible. This is something that I talk to my mom about all the time. She has a respiratory lung disease that makes it really difficult for her when she unfortunately inevitably gets sick with the flu or COVID. Often it turns into pneumonia, as I discussed, um, is something that can happen. So you want to make sure that you're preparing ahead of the time, talking to your doctors, and even managing your stress. When you're sick, you're already stressed enough. So managing, having a good routine, good getting some good rest, having a self-care plan can all help you be able to manage illness better. And preventing illness by washing your hands, having good hygiene. Again, Maria talked about this a lot. Avoiding close contact with people when they might be sick or you might be sick, just to ensure that you're preventing that spread as much as possible. And earlier I mentioned winter storms, severe weather. Those are the kinds of things that can disrupt anyone's life. But if you're someone with a chronic health condition, you want to also make sure you're having an emergency supply kit on deck. If you were to need resources because the lights went out or something like that, or you have to evacuate for some reason, you want to make sure you have that 2 week supply of medications, extra food, water, supplies, medical supplies, and even updated contact lists for emergency contacts. So we're the preparedness unit. We like to just plug this whenever we can for people to be as prepared for emergency situations as possible. And unfortunately, sick days can still happen and they likely will. So it's also important to prepare ahead of time for sick days and what those sick days actually look like. So you have the supplies that you need if you were to get sick. Your neighbors, if your neighbors were to get sick, you want to make sure that they have the supplies they need around the house and know what exactly they need to do to stay as healthy as possible. So that can look like keeping those at home testing kits on hand. Go anywhere you can to get them for free. Keep them on stock. Most of them are don't even expire until September of next year. So it's important to know what virus you might be dealing with, because if you have a chronic health condition, depending on what virus you're dealing with, that depends on the treatment you might need so that you can be as healthy as possible. Monitoring your health, so that means checking for those symptoms of your chronic health condition. So those symptoms might worsen, and even looking out for those respiratory symptoms, new symptoms that you don't know about, and those emergency symptoms that Maria went over. Knowing those things can help you act fast when necessary. And having a sick day plan in general. You want to discuss a sick day plan with your doctor. If you have elderly neighbors that are have chronic health conditions and might need to plan for if they get the flu this season, encourage them to talk about these topics with their doctor, asking what kind of fluids and food they should drink and have while they're sick. We everyone loves to give advice and say, "Oh, just eat some chicken noodle soup and, drink some Gatorade or something like that." But that might not be the best advice for everyone. Like Maria stated earlier, what works for you, it's going to look different for everyone because of underlying conditions and things like that. So it's an important thing to talk about. Do any of the medications that someone is taking need to be adjusted if they were to get sick? What do those over-counter medications look like for them? What are they able to take? Again, Maria said it. If you have high blood pressure, maybe you can't just go get every cough syrup off the shelf. You want to talk about that with your doctor. Make sure you know what medications you can take that are over the counter to help manage your symptoms when you are sick, or when your neighbor is sick, or your family member, or whoever. And then, and most importantly, knowing when to call the doctor or seeking medical attention. Talking about that with your doctor, saying, "Hey, if I were to get sick, what are some things that I should look out for when I need to call you? I need to come into the office, or I need to get over to the emergency department." These are all things that can help prepare for sick days ahead of time, so that you can be on the mend quicker rather than later. So I'll just go over some key takeaways as well. Some key takeaways, we hammer it home all the time. You guys know this. We make sure that everybody gets everything they need. So you want to make sure you have those vaccines, that flu, that COVID, and that RSV vaccines and immunizations to help protect from severe disease, hospitalization, and death. You can get all these at the same time. Like I said it before, quick, easy, done. Might feel a little bad after, but at least you have gotten it out the way and you've taken care of everything that you need to take care of. And then speaking with the primary care provider for all those reasons I just mentioned, about eligibility and anything really, is important. So finding a good primary care provider that you trust is needed. And you want to protect against these viruses by, again, getting immunized, staying home if you feel sick, and seeking treatment if needed, and testing if you're sick so, again, you know which one you're dealing with. You want to do all these things to protect yourself, your loved ones, and your community, those neighbors that you love so much that you come out to these trainings for, that you get all of this information so that you can pass it out to them. These are the reasons that you want to make sure you're following all these steps. If someone has health insurance, they can easily, hopefully, make an appointment with their doctor or local pharmacy to get their vaccines. We also want to make sure that people that don't have health insurance, or have a health insurance that doesn't cover everything they may need, can have resources as well. So that can look like visiting the local health center, and calling ahead to making sure they have vaccine eligibility. King will go into a little bit more details about the health centers. I won't step on his toes too much with that. And the same thing with our primary care provider that I've literally mentioned probably 50 times now at this point. Finding an affordable, trusted primary care provider is um, very, very important. So I will actually end it with a little question and poll myself. So seasonal or yearly vaccines are not important. Not important because viruses do not change. They never change. They stay the same. So you don't need to get a vaccine. Is this true or false? I'm seeing a whopping false in here, so some good answers. Yes, I love to see these answers come in. We have about half people available to. Great, great. Literally everyone has said false, and you guys are absolutely correct. It is false that vaccines are not important. They are important, and everyone who's eligible should be getting them. I'll turn it over to King to give you those resources and services, which you guys really came for. Um, yeah, take it over.
All right. Now we're going to discuss some of the resources that are available to you and offered this summer, this fall. All right. So the first resource we'll discuss are the free at-home COVID tests. So the Philadelphia Department of Public Health, we have resource hubs around the city that distribute at-home test kits and provide many other resources, as you guys can see on the screen. In front of you, resources like HIV test kits, condoms, other sexual wellness materials, harm reduction supplies, nicotine replacement therapy, and the list goes on. If this is But the good thing about this is that the good thing about these resource hubs is that they require no insurance or IDs to visit these resource hubs. So if this is something that interests you, or you know someone who probably doesn't have insurance or have access to an ID, this is a great resource to share with them. Essentially, all you would do is just click on the link bit.ly on the screen, and it will take you to another web page where it'll show you the hours in operation and the addresses, so you can pick whichever locations are closest to you. All right. So another resource available are the low-cost vaccines. They're free. They're low-cost vaccines are offered to people without insurance and are available at health centers around the city. Just like I previously stated about the other resource, if you don't have insurance, they still will be able to provide assistance to you all. Essentially, the only thing that we like to tell individuals that we like to stress is just making sure that you guys call these health centers in advance, simply just to make sure that they have the specific vaccine that you are looking to acquire. And again, just to see those locations and hours of operations, you would just click on the bit.ly on the screen. That will take you that will link it to the actual another web page where you can see all the available locations and hours.
I just wanted to chime in really quickly, King, and say that I believe that the health centers are the ones that you do need Philadelphia residents. That's the only difference between the resource hubs and the health centers. That wasn't noted on the slide, so I wanted them to know that.
Perfect. All right. So in addition to the resource two resources that we just recently spoke about, we also have the PDPH call center. The PDPH call center will answer any questions you may have about COVID-19 testing site information, resources, and places to get vaccinated. They will also provide vaccine record requests, public health guidance, and other information as needed. So the hours of operation will be anywhere from 8:30 a.m. to 5 p.m. Interpretation in other languages are also offered. Essentially, all you'd have to do is call the number above and press 2 for Spanish and 3 for other languages. Okay. So everyone needs to have a doctor or primary care provider they trust. It is important to have a trusted primary care provider to answer questions or concerns, especially in times of public health information uncertainty. I know for me, I've been with my same primary care provider for a couple of years now, but prior to that, I was jumping around here to there to there. Why? Because I felt like I wasn't being valued, not even being valued, but I wasn't being taken care of the way how I knew I could be taken care of. When you I feel like we all can relate on this experience when we go visit our primary doctor, or even just going into emergency room, or even just going to urgent care. We spend so much time sitting in the waiting room, and then we spend so little time when we actually get to finally meet that primary care doctor or whoever will be meeting, and we spend like what, maybe 5 to 10 minutes with them, and then we're off on our way, right? We don't, at least I know when I was going through those things, I didn't feel like I was being heard. I don't feel like the doctors really cared what was going on with me. So I took the time to try to find a primary care provider that I felt like actually cared, or at least they acknowledge what was going on. So basically, like our producer stated, we'd like to remind everyone that it is okay to switch primary care doctors until you find one that fits your needs and makes you feel comfortable. So the primary care provider can help people stay healthy and treat any health problems that arise. So contacting a primary care provider when someone is experiencing any health concerns, or if they have questions about their health or public health guidance, is essential. This website lets individuals search for providers by location, language if needed, and other fields also. So it is designed specifically for people who are uninsured or underinsured and need free or low cost medical care. All right. So basically what we have here, this is some of the materials that the public health department utilize for fall outreach essentially. The good thing about this is if you guys are interested in any of these materials, you guys can order them. If you see the newsletter in the middle, there's a bit.ly link there. Essentially, that bit.ly link will take you to a material request form where you can request materials of any of the materials you see above. The good thing about that is they will be free, they will be printed, and they will be in colored. If you need them in other languages, that can also be provided also, and then we can either mail them to your home addresses or work addresses, whichever is preferred, or you can come to our centralized hub to acquire the materials. And it's a great way to ensure that you have the most up-to-date materials to hand out to your community members and coworkers. All right. So as we gear up for winter, we should make sure that your network is connected with utility resources. The neighborhood energy centers can help residents weatherize their homes, understand bills, and connect with assistance. You can go to the website or you can scan the QR code to view the neighborhood center locations, hours, and services that are available. Next, we have is the Utility Emergency Service Fund. So this helps stabilizing housings for families facing housing crises by addressing their immediate needs and removing the barriers to long-term stability. So they can help with things like referrals, resources, educational workshops, and the list goes on. They are open on Monday through Friday from 8 a.m. to 5 p.m. Visit their website to learn more about the information, or you can scan the QR code where it will bring up their contact form. Okay. All right, we're almost done. The end is almost near. The next resource that we'll discuss is just the Bennett Philly, which basically offers one-on-one support to connect residents with non-income based benefits and help affording costs such as prescription drugs, health insurance, food, property taxes, and guys can see the other fields that they can also help assist with also. And then last but not least, mental health. Individuals' mental health and well-being are very important. If you or someone you know is experiencing a mental health crisis, please call the number above, which is 215-685-6440. Interpretation is available for 24 hours a day. So if this can benefit you or someone you know, we just ask that you please just share this information with them. Another good resource is the National Suicide Prevention Lifeline. We like to say that this is the 911 number for the suicide hotline prevention. This is a quick and easy number for individuals to remember, just being 988. This is an easy number to remember, and it also provides 24/7 interpretation also. Or and if neither of those things can benefit you, or you feel like they're not as useful, you can always visit the free online behavioral health screening and resources by visiting healthymindsphila.org. All right. So previously, in the beginning of today's presentation, I stated that we'll be having a poll towards the end of today's presentation, so we can figure out essentially what were the best sections or what sections stood out the most to us, which ones we felt like were most engaging, which one we felt like community members can get the most out of, and the list goes on. So now you guys have a chance to vote on your top three sections that you felt were most important for today's presentation.
We see that you all are answering the poll. We really appreciate your feedback. This is so great. As Block captains, your feedback is important in shaping like what we share with the public. So we appreciate you taking the time, one, for joining us tonight, listening to our webinar, and two, for taking this poll so that we can make sure we get the best information out to the public, on social media. So, yeah, if anybody has any questions or anything like that, then please do let us know. King, if it's okay with you, I'll just continue talking and wrapping it up since I
Yep.
literally started talking. Um, our, as always, we want you all to stay connected and informed. You can email us, call us at this number that's on the screen and in the chat. Again, ordering those resources from us for materials to hand out to your neighbors and reaching out to have us come out into your community to do a training, this training specifically, resource tabling, giving out our materials. And don't forget, we say it every time, make sure you sign up for Ready Filla. Ready Filla, text Ready Filla to 888-777 so that you can get all sorts of information to your phone about what's happening in Philly. Of course, Francis and Brenda, we appreciate you all for coming and listening to our information. Again, a follow-up email will be sent out with slides, video link, and all sorts of information for everyone that registered and was able to join tonight. So, uh, thank you again for joining us. And you guys have a good rainy evening.